Welcome everybody to our latest online webinar in which we will discuss the findings from a new report launched today online on thr.net titled Tobacco Harm Reduction and Better Treatment of Lung Cancer Could Save 280,000 Lives in Czechia by 2060. And here is the report, as you can see. So the world-renowned public health experts who authored this report recognize that the burden of smoking and its related diseases in many countries around the world is still a major health problem. The report details that the global progress to reduce smoking rates has stalled, and more needs to be done by the WHO and governments to reduce the death rate from smoking and toxic, unregulated oral tobacco products. But this report today focuses on Czechia. So Czechia, along with Sweden, is quite unique when it comes to tobacco control because most alternative products are actually legally available. For example, e-cigarettes, oral nicotine pouches, and heated tobacco products. The government supports policies that promote harm reduction for tobacco use, including the regulation of alternative nicotine products like nicotine pouches and e-cigarettes. And during its presidency of the EU, Czechia emphasised harm reduction, advocating for these approaches as a means to reduce smoking rates and associated health risks. Regulations for nicotine pouches are being developed to ensure their safe use, further highlighting the country's commitment to harm reduction strategies in tobacco control. So we note that the use of the full range of THR products remains low in Czechia, creating opportunities for health gains if use increased. Czech scientists are at the forefront of research assessing the benefits of several THR products. So Dr. Derek Yach of the US calculated the combined impact of embracing THR, better cessation services, and improved lung cancer treatment in Czechia. The analysis shows that 280,000 lives could be saved by 2060 through these interventions, compared to continuing with current WHO-directed tobacco control efforts alone. Now let's remember the main goals of public health, which are to prevent disease and premature death. So this report is a timely reminder of alternative solutions to curb the smoking epidemic beyond standard tobacco control. I will now present the agenda and the speakers for today's webinar. So we have, first of all, I've given an introduction. So why has the focus been on Czechia for this report? Then we have Dr. Derek Yach, who will provide a keynote speech and a comprehensive report overview. He'll discuss the study rationale and significance, the methodology with the results and recommendations. And then we have Professor Mariva Glover of New Zealand, who will actually discuss the learnings from New Zealand. So what can we learn from this country regarding tobacco control, and how has vaping helped to accelerate the decline of smoking rates? And then finally, we have Dr. Delon Human of South Africa, who will discuss the importance of this study in Czechia. He'll provide the example of Sweden, which is a really interesting case study for tobacco harm reduction integration with tobacco control, and how Czechia and other countries can learn from this study. So now the biographies. So here we have Dr. Derek Yach, the lead author, who's a former WHO and PepsiCo executive. He holds a degree in medicine from the University of Cape Town and a master in public health from Johns Hopkins. Dr. Yach played a key role in the WHO Framework Convention on Tobacco Control and led global health at Yale and the Rockefeller Foundation. He currently focuses on smoking cessation, mental health, and healthy diets as a healthcare consultant. Dr. Delon Human is a physician, and he specialised in family health, children's health, and he also served as Secretary General of the World Medical Association and later the International Food and Beverage Alliance. He has extensive experience in global health strategy, harm reduction, and healthcare access. Professor Mariva Glover of New Zealand, who is a leading tobacco control researcher, and she has worked on reducing smoking-related harm for 31 years. And she's recognised internationally for her advocacy work in tobacco harm reduction, and was also a finalist in the New Zealander of the Year Supreme Award in 2019, recognising her contribution to reducing smoking in New Zealand. So now we will start with the keynote speech from Dr. Derek Yach.
Yes, thank you, Jess. It's a real pleasure. Let me just first put the context again to remind people who haven't been following the Save Lives work. We still have 1.3 billion people using tobacco in the world. They're dying prematurely at the rate of 8.5 million a year. So this is a big public health problem. In the Czech Republic, which has a relatively small population of 10 million people, about a quarter of the adults, about 240 million people, smoke. If we look at the men and women, about a third of adult men smoke and about 25% of women. Both put them in the higher categories of smoking, both in Europe and globally. And the smoking rate among women is particularly worrying. It's about the highest that we have in the world. As a result of this, it's not surprising the death rate is so high. About 18,000 people in the Czech Republic die every year of the major causes of tobacco death. Against that background, we set out as a group of international experts to work with the folk in the Czech Republic to ask the question, how many lives would be saved over the next few decades beyond those who we expect to be saved through the traditional WHO framework convention approaches? In other words, continue the work on taxes, continue to address advertising, marketing to kids, and so on tobacco products. But if we were to add in tobacco harm reduction and ensure that it was made more widely available, if we were to use what is emerging as better forms of smoking cessation, and if we were to address the largest cancer cause related to tobacco, namely lung cancer, through better medication, what would we actually see in terms of lives saved to 2060? We did this by using a range of different modeling epidemiological studies, and you'll see that the assumptions are very well outlined in the report, and we encourage people to look at them. We drew upon fairly conservative estimates, so we're not trying to overinflate the data, and we believe that whatever we say is probably an underestimate of what's likely to happen, given the rapid pace of us now having even better harm reduction products. So what do we mean by tobacco harm reduction? We referred particularly to the emergence of a range of products that have been shown to remove the combustion, which is the reason we die, as well as the toxic substances in smokeless tobacco. And they include particularly vapes or e-cigarettes, heated tobacco products, nicotine pouches, snus, and increasingly we're starting to see shisha, water pipe, particularly e-shisha, starting to appear also in the Czech Republic. We looked at 2060 because it's a realistic time to start seeing real impacts on long-term effects. And remember that tobacco takes a long time to have its effect on populations and a relatively shorter time to start seeing the benefits. And our main interest is in adults. We don't go into it, but the report implies that we do not support the access of either any tobacco product or nicotine product for youth or teenagers. So in doing the study, we were able to show that if we were to give better access to the tobacco harm reduction products, the current figure of about 18,000 deaths a year was estimated to drop to 12,000 under the status quo approach of WHO. That means steadily increasing taxes and regulations and so on by the late 2050s. Remember that figure, 12,000. We estimate that that would go down to under 5,000. So a huge drop per year. And if you then calculate the cumulative benefit of all those deaths being saved, lives being saved over the decades, we come to a figure of over 250,000 lives to be saved before 2060, or to be more exact, 280,000 lives to be saved in the Czech Republic. To put it in context, there is no other public health measure that you can think of that would save 280,000 lives, or even that comes close, whether it's antibiotics or whether it's vaccines or whether it's treatment of hypertension or diabetes or whatever it is. This is a mega number which would bring a reduction in massive suffering, pain, economic costs, and so on. So if that's the case, what would it take to actually make it happen? The good news, and what makes this particularly interesting in the Czech Republic, is that as far as I know, this is the first country in the world where they have deliberately integrated tobacco harm reduction into their national strategy of harm reduction. What do I mean? I mean that when they address things like alcohol, drug abuse, HIV/AIDS, they use risk proportionate regulations. They decriminalize people and put the focus on the treatment and the human rights needs of individuals, whether they're using drugs or alcohol or maybe having unsafe sex. The same basic principles are being applied to tobacco. And in the last year or so, they've been strengthening the integration to make sure that they have a coherent approach, which basically says we could be applying harm reduction, particularly in these complex areas of behavior, to help people really move away from high risk to low risk and maybe ultimately to no risk. And we believe that that is a sensible way to go. In that context, all of the major tobacco harm reduction products are available on the Czech market. The regulatory environment is varied, but generally all of them are legal to some extent. Even snus, which is banned across the EU, and they are a member of the European Union, is permitted for personal use, so it can be imported, even though it can't be sold on the streets of the Czech Republic. Nicotine pouches, vapes, heated tobacco products are all widely available. Interestingly, the taxes and pricing on heated tobacco and e-cigarettes favor the use of the safer alternative, heated tobacco and e-cigarettes, against the combustible version. And similarly, the messaging generally coming out is more positive. Now, this has only been in effect for a relatively short while, and we believe it'll take a while to play out. And as you can see, still with a smoking rate of 33% among men, 26% among women, we've got a long way to go. We believe that there's a real chance that this could become a message for the rest of Europe and the rest of the world. And we're hoping that that'll be a message that our colleagues from the Czech Republic will carry forward. Clearly, the role of physicians, like in all of the other countries, is fundamental. And we particularly believe that they play a central role in advising their patients about the value of heated tobacco products, vapes, snus, nicotine pouches. We hope that we'd see government invest in more research locally. We've already seen that the private sector has been carrying out very important research showing the benefits of heated tobacco products as giving us results on reducing and switching far greater than you often get even from nicotine replacement therapy. And finally, I'd say that for the ownership to be felt by the people of the Czech Republic, we need to see an equivalent of the Royal College of Physicians report, which is led by physicians and the academy and lays out the benefits to the population as a means of stimulating doctors, physicians, and nurses. And we know that there are very powerful academies in the Czech Republic, the Czech Academy itself, that actually do this very well, and we believe it'll have a big impact.
Thank you, Derek. So it seems quite clear then that even though the government of Czechia has integrated tobacco harm reduction in the national strategy with tobacco control, there's a lack of communication, perhaps, do you think, or education of consumers, the public, physicians? Do you think there's a gap that does need to be addressed between the government and the rest of the country? And how do you think they could go about doing that?
Yes, I think, there's always a delay between often setting a policy and then having it fully implemented on the ground. But as I stressed, I think that the door is open. And now I think I would hope that we would see what happened in so many other countries, that the countries who really are advancing the practical implementation, like the UK, like Sweden, like New Zealand, and even Japan, all with products doing it, need to pile in and give greater support to the Czech Republic on how they can practically make what now looks like general policy statements be felt by people on the ground and be seen in terms of access. The companies seem to be doing pretty well as far as they can. They need to be encouraged to be going further. As I say, the products are all on the market, the regulatory environment's in our favor. But until the physicians, who remain the most powerful gatekeeper, start saying in numbers to their patients we really believe that you have a better chance to get off the deadly combustible cigarette if you try whatever the product is. We're not going to see enough progress. And that physician education always takes time. But we know it's possible because it's been achieved to an extent in HIV/AIDS, in alcohol, and drug abuse.
And do you think it's safe to say that there is actually growing consumer demand for these products in Czechia?
Absolutely. Yeah. No, if you look at the numbers, the sales numbers, the consumer data, you look at the marketing trends, we are seeing the heated tobacco market being one of the more successful in the world, starting to take off with a number of companies competing. The vape and the e-cigarette market has been quite strong for a while. And now I think we're going to see a lot of innovation in the nicotine pouch area, not just in the Czech Republic, but worldwide. And I suspect that will also start picking up.
And regarding COP11, which we know is coming up next November, what is your advice to member states regarding harm reduction and taking any learnings that we can take from Czechia or even other countries to those countries?
I think we've laid out for so many countries the enormous value, if the interest is in saving lives, of ensuring that COP11 finally bites the bullet and says, in the beginning, Framework Convention included harm reduction as an integral part of tobacco control. Let's act on it. And acting on it means, number one, accept that the science is getting stronger and stronger and stop the disputes around whether these are substantially better alternatives than combustible cigarettes. Clarifying that is incredibly important. And as you know, we have not just the FDA and the UK government, the New Zealand government, the Swedish government, many governments around the world, including in the Middle East, now accept the evidence is strong and overwhelming about the net benefit effect. Second of all, then to get down to the specifics and think carefully about how you actually adapt the tax policy to make sure that there's a tax differential that favors people using the healthier, the safer, the lower risk alternative. And most importantly, that the messaging isn't as confused as it is now. We need clear messages which say that nicotine is not the problem. It is not causing cancer. Tobacco harm reduction products are not more dangerous than cigarettes. Both of those concerns are already being expressed by physicians in many of the surveys we've seen going in the wrong direction. I think that COP11 making a statement about the value and the benefit of tobacco harm reduction, even if it takes time for the regulations to come into effect, that statement itself will be heard by the physicians worldwide, and we'll start seeing some actions.
It might be worth mentioning as well that people fail to realize that smoke and vapor are actually different. So often we call vaping smoking, or people call vaping smoking. So do you want to just quickly discuss the differences between smoke and vapor and why these really mustn't be confused?
Yeah, absolutely crucial. Every time I get on a plane, I get infuriated when they say to us, um, smoking kills. You may neither smoke nor use your vape in the toilet. An alarm will go off. Well, first, it's factually incorrect. The alarm actually won't go off with a vape because there is no smoke. I'm not asking people to go and test it, but it's vapor. Whereas in cigarette smoke, we have particles which deposit themselves in the lung, which carry nitrosamines, which cause cancer, a range of heavy metals, and a range of other dangerous products. Those are the things that are killing you, not the water vapor with some nicotine and maybe some propylene glycol. That is not going to kill you, and there have been no studies showing it. So I think we really need to understand the fundamental difference that smoking involves combustion, vaping does not. It involves many vapors. And then, of course, nicotine pouches involves neither of those. It's mainly going to be nicotine with a bit of flavorant going into your mouth, no difference from an activated chewing gum, for example. And then I think particularly in the context of the Czech Republic, where adult smokers tend to be slightly heavier smokers than in many other parts of the world. And many of them are smoking 15, 20 a day. And it's particularly in the group over the age of 40 who smoke 20 a day, where we see the highest levels of lung cancer and COPD risk. Now, if people have been smoking for as many years and by the age of 35, 40, are able to quit or completely switch, they will revert to the status of having been a never smoker very quickly, within a few years. If they quit between 40 and 49, depending on how much they smoked, they will gain anywhere between 10 and 11 years of life expectancy. And even if they quit between 50 and 59, they'll gain between 6, 8, 9 years of life expectancy, making the point that we should not be writing off a smoker when they are age 40, 45, 50, 55, or even 60, because the benefit to their life, to their quality of life, to their family's life is substantial. And having done a lot of the work, I know that, again, in public health, there are very few interventions where we can actually say with fair certainty to somebody in their 40s or 50s, making a change will bring you higher quality of life. Alongside these would probably be blood pressure control, blood glucose control, vaccines, and very few other things that fall into that same category.
And can I have one final question? So now we have the report, which has been launched today. What can we as advocates, and advocates can be scientists, physicians, consumers, what can we as advocates do with this report to try and make a difference?
To my mind, the most important difference of this report compared to the other reports is that it allows us to say that Czech Republic has shown that you can integrate principles of harm reduction between tobacco, alcohol, AIDS, and drugs. This is an enormous step forward, and it suggests that having a mixture of a human rights and a science-based approach is the way forward. Then the technical aspects, I think we all have a role to ensure that the physician population really understand the evidence, the governments understand the benefit, and that the advocates and the NGOs join forces across the general harm reduction world, the tobacco harm reduction world, to sing in that same strong voice that we can save lives and improve the quality of lives by applying the same principles that we're seeing are succeeding on drug abuse and alcohol and everything else. And I might say that we're releasing this report at a very interesting time in the US, when for years we've seen rising levels of drug abuse causing substantial deaths in the US population. Literally in the last couple of weeks, we've started seeing this starting to reverse. And the main reason for the reversal appears to be the application of harm reduction, being able to give people who are seriously engaged in drug abuse the drugs and medication to actually save their lives. Same principles need to be applied in the area of tobacco.
We will now move on to Professor Mariva Glover of New Zealand. Welcome, Madhava. It's a pleasure to have you here to discuss a new report about tobacco harm reduction in Czechia. And you're one of the authors of this report being launched today. So we are excited to hear your views about this interesting country and its tobacco harm reduction policies. So the report recognises that the government of Czechia is uniquely placed to lead other countries to embrace tobacco harm reduction, given that it has already integrated THR into its broader national harm reduction strategy and has implemented forward-looking, life-saving regulations to end tobacco use. The report considers the benefits that tobacco harm reduction products could have on such trends. And THR products, things like vapes, heated tobacco products, snus, nicotine pouches, and charcoal-free shisha are rapidly gaining traction among consumers in Czechia, with all categories of THR legalized for use. So these innovations have not yet been fully embraced by physicians and governments as key to cutting premature deaths in the country. So we note that the use of the full range of THR products remains low in Czechia, creating opportunities for health gains if the use did increase. So Czech scientists are at the forefront of research assessing the benefits of several THR products. So the report details the calculations of the combined impact of embracing THR, better cessation services, and improved lung cancer treatment in Czechia. And the analysis in the report shows that 280,000 lives could be saved by 2060 through these interventions, compared to continuing with current WHO-directed tobacco control efforts alone. So Madhava, can you please provide your views on the report and the findings?
I think it's very exciting that they have legalized a full range of the harm reduction alternatives to smoking. So that is quite unusual, really. I mean, I think Iceland have that, and some other countries, not all the countries that have adopted a tobacco harm reduction approach and incorporated into the business as usual tobacco control program, like New Zealand and the UK, have regulated the full range. But where the full range is available, then people have more options, different strokes for different folks, and it doesn't leave people out or behind. For example, if vaping is not to somebody's liking, then they have a choice, they have another option. So in New Zealand, for instance, the government regulated vaping and also heated tobacco products. However, advertising of tobacco products is banned, so very few people in New Zealand know about the heated tobacco product. So vaping is the main one that people in New Zealand know about, and that has accounted for most of our rapid decline in smoking prevalence. I would expect, and it will be exciting to watch what happens in Czechia with this full range available, and a very important case story to follow, I think.
Yes. And why do you think it's important to calculate the lives saved of adult smokers and to actually document this and amplify it?
These alternatives to smoking are greatly risk reduced. The biomarker studies, the example of Sweden shows that if you can cut those toxins, and we're talking about cutting them by 95, around 95%, then like Sweden, we will also all see a reduction in smoking-related diseases and deaths. There will be a lag because smoking-related deaths is a chronic condition, and it takes a few decades of regular use. But even so, and it's said in the report, we put it in there, that quitting at any age, you begin to see improvement in health.
I think having that number as well, 280,000, it kind of provides some meaning behind, just the potential of these products and just the impact you could have if, obviously they are legalized in Czechia, but maybe that's not fully communicated and encouraged in terms of the physicians and physicians communicating the benefits of them to their patients. So I think that could be where there's a potential and an opportunity to realize the full impact of these products, especially if physicians could embrace them and then communicate their benefits to their patients, do you think?
There's huge debate around the potential for these alternatives to smoking that are greatly risk reduced. And there's a lot of misinformation being put out globally to scare people off them, and many physicians around the world are exposed to that misinformation and are believing it. We're now at the situation where the evidence is quite strong. We have reached a tipping point in terms of the evidence for e-cigarettes are one of the most effective ways to assist people to stop smoking. We know from the Swedish example that snus works, and the evidence is building now for oral nicotine products and the heated tobacco products. The problem really is this misinformation and the World Health Organization's stance on these products, that they do not want people to have access to them. What we're getting into now is the situation where you have some countries where we have regulated the products. New Zealand government is encouraging people, if you cannot stop smoking any other way, then please switch to vaping. They have a vaping facts website to address all of this misinformation that's being promulgated through the media and you know, direct kind of information being given to physicians and teachers and everybody. So the New Zealand government is actively trying to work against that and encourage people to switch. And we really are at the stage that people standing in the way of people moving to these products are stopping the lives that will be saved. So the deaths will continue. And this is why it's so important to actually model and quantify the number of lives that will be saved and that will not be saved if you stand in the way and if you stop people having access to what really are going to be life-saving for many, many people products.
Exactly. And I'm really glad you speak about New Zealand, because you did author a report this year about New Zealand, and you were the principal author. And the report brings together all of those points that you just made about what the New Zealand government has done to regulate vaping, how the smoking rates have come down drastically in New Zealand in the last 10 years. And New Zealand is actually going smoke-free. So we will amplify again that report, and we'll provide a link to it beneath this recording in YouTube, just so that people can read this, a nice summary of what you've just said.
Yeah, it's so important that the government it's so important that the government encourages the community, the medical community, and the smoking cessation programs to get on board and encourage people to switch to these products, and fast. And that's what we've experienced here. So in New Zealand, all of the government-funded smoking cessation programs, the Quit Line, which is a national free cessation service, and local cessation services, they've all been given the encouragement, if not told, to encourage people and help them to switch to these products. So having cessation, good cessation support available, and having that cessation support incorporating advice on how to switch to these risk-reduced alternative products is important.
Exactly. And when you can see in the New Zealand report that you authored, when you can see on the graph the introduction of vaping, when the government allowed it and communicated it, and you can see how the smoking rates were declining to almost a smoke-free level. We're not there yet with New Zealand, but we're nearly at smoke-free. So you can see how, you know, the government can have such a big impact if it's just communicating the benefits. And what would you suggest that, anything else you suggest that the WHO and government should do to improve tobacco control? Are there any final recommendations or any key points you would like just to highlight before we finish?
I mean, the World Health Organization, the Framework Convention on Tobacco Control, is so disappointing that here we have a rapid way to get people to stop smoking quickly, easily, and cheaply. You know, people buy these products themselves, so it's not even going to cost governments. So low middle income countries that don't even have cessation programs, it's a great opportunity, and it's very disappointing. I don't know who is working in there anymore, but they're wrong. And the lives that have been calculated in this report and a number of the other reports, they will not be saved. The World Health Organization is standing in the way of that happening. Something's got to change. The evidence is getting stronger and stronger, and yet they will not budge.
Now, Dr. Delon Human will discuss the importance of this study for Czechia and other countries, and will also provide some conclusions at the end.
Thank you, Jess. This report makes an important contribution to a new approach in tobacco control if we were to allow tobacco harm reduction methods and products, along with an early diagnosis of lung cancer and improved smoking cessation. to help those adult smokers who are seeking a fire escape. Many smokers just cannot or will not quit. And in Czechia, if these individuals were provided with accessible, affordable, and acceptable smoke-free alternatives, it might save their lives. And that's indeed what the report shows. That if tobacco harm reduction were implemented, along with an early diagnosis of cancer and improved smoking cessation, up to 280,000 lives can be saved in Czechia. Now compare that to the years in COVID, an epidemic that brought the world to a virtual standstill. WHO and governments tried their very best to reduce harm and reduce the serious infections that led to premature death. And despite all of those efforts, there were still 2 million deaths at least. In tobacco, there are 1.4 billion smokers in the year today, of which 8 million die every year. Just compare that, 8 million per year versus the 2 million that died during COVID. And in fact, there's a solution waiting in plain sight. And that's exactly what we were trying to do with this report on Czechia, which has a population of 10.6 million people. 2.4 million of those are smokers, and 18,000 of them die prematurely every year. And just by the way, 26% of the smokers are female, which is actually highly unusual and a high total of smokers in any population. So we feel that this report will make an important contribution to the conversation about tobacco control and how it can be augmented by tobacco harm reduction. What do we mean by tobacco harm reduction? Simply that adult smokers would be given access to smoke-free nicotine alternatives. It's the smoke that kills, not the nicotine. And we would like to urge governments, WHO, and all stakeholders to carefully consider the contribution that tobacco harm reduction can make. Often the mistake is made that the question is, well, what if these various smoke-free alternatives are dangerous? Are we talking about e-cigarettes or vapes, oral nicotine pouches, and heated tobacco products? The question is always, what if they were dangerous? But shouldn't the question really be, well, what would the contribution be if these products were made available to those smokers who couldn't just simply quit? And that's exactly what we've tried to do in this Czechia report. We hope that you will read this report with interest, that you will critique the methodology, and that you would also do your own research to see how many lives can be saved in Czechia. We would also like to invite you to look at some of the other countries that we've done simulation studies on, and I'm showing you the slide. And you can see that literally millions of people can be saved if tobacco harm reduction were allowed to be implemented. After COVID, several lessons were learned. In the field of tobacco control, 3 lessons stand out. Number 1, respect the science. And the science is clear that nicotine smoke-free alternatives can contribute towards smoking cessation. Number 2, communicate risk accurately and honestly, and eliminate misinformation. And then lastly, there is a role for risk proportionate regulation in tobacco control. And if tobacco harm reduction products were made accessible, affordable, and acceptable to adult smokers, especially those who just simply cannot quit, we can save lives. And we hope that this report will stimulate the debate into the role of tobacco harm reduction in Czechia and beyond. Tobacco harm reduction works in countries like Sweden, where the government, through risk proportionate regulation, has made it possible for Swedish adult smokers to have access to affordable and acceptable smoke-free nicotine alternatives, such as snus and oral nicotine pouches. And this has driven down their smoking prevalence to 5%, which is the best in the world. It is also fitting for the Czechia report to be launched during the week of the United Nations General Assembly. They will host a conference this week called Summit for the Future. Here, the United Nations is calling for multilateral solutions for a better future. And this ties in well with a significant document adopted by the United Nations in 2011, the UN Political Declaration on the Prevention and Control of Non-Communicable Diseases or Chronic Diseases. They set as goal to reduce deaths of chronic diseases by 25% in 2025 and 33% in 2030. Unfortunately, these goals will not be met if governments of the world do not embrace the call by the United Nations for a whole of society, whole of government approach and engagement with all stakeholders. Through this report, we urge all stakeholders, and particularly WHO, UN and governments, to consider the best practices such as Sweden, United Kingdom, New Zealand, and then take into consideration countries like Czechia, where we've shown that harm reduction can strengthen tobacco control and save lives. Thank you.
Many thanks to the authors and our speakers for providing their input to today's webinar, and a big congratulations to them for the launch of such an interesting and important report. You can all find the report on thr.net's website and the thr.net X social media channel.